So if you walk around the campus, you will notice that we have three quite distinct buildings or facilities. One is obviously the largest one is the towers that represent the acute inpatient and community hospital types of wards. And of course, we house many of the other services in this main podium or main block. Right in front of the campus, we have the medical center, which has this gray and blue kind of facade. And then at the back is the long-term care block, where it houses the nursing home and the eventual hospice. They all look very different. And one could say that if you put a fence in between these would be three very different buildings built by different architects. But they were all built by the same contractor. They were all designed by the same architectural firm and designer, working closely with us. We wanted this very eclectic kind of look because we felt that the needs and the requirements of patients and the public for these three very distinct facilities were quite different. People who come to the outpatient building or the SOC, the medical center, tend to just come for a couple of hours. They expect fast throughput. They expect efficient service. So the whole look and feel of the building was about that efficiency, about being very modern as well as technology driven. The main podium and the inpatient blocks are where patients stay for anywhere between 3 days to perhaps even 30 days. And for that, therefore, we felt that the whole look and feel of the building needed to encompass one whereby there was confidence that patients would get that everybody there is very professional, and the stay that they would be there for, however long period of time, would be comfortable but not too comfortable, and whereby it is a fairly serious environment because it's inpatient care. The last building, which is the long-term care block, was deliberately designed in a more warm and friendly and almost home-like environment. And the colors I remember that were chosen were very, very home-like and very inviting and comfortable, because it would house the nursing home where patients would be there mostly to the end of their lives, and also eventually it would house the hospice where people would be at end of life. So these three designs were all deliberately done, and therefore they do appear to be quite different. However, underpinning all this, we felt very strongly that there needs to be consistency in terms of how we deliver care, and that is the software or the hardware of it all, not so much the infrastructure. And that is where we are striving to ensure that regardless of whether you are in the medical center or in the inpatient block or in the long-term care block, long-term care facility, you will receive that level of consistent care, quality, compassion, that would be, and in the best interest of the patient, that would be, of that level where the patients would end up trusting and happy with what we are providing.